Hello, my name is Kathleen Lisson. I'm a certified lymphedema therapist and board certified massage therapist. I practice in San Diego. We're here at my studio in Pacific Beach now, and I want to show you what I do for what I call plastic surgery recovery massage. So I'm here with my husband today. So usually on a man, they will have liposuction to the abdominal area. They might also have some care for gynecomastia. They might have liposuction here or further surgery in the upper chest area. If it was a woman, I would always drape. I just put a chest drape right here. If the woman has if she had any kind of breast augmentation surgery, often she will want to have the bra that they give her after the operation. She'll want to keep it on, so I usually let them keep it on, and then I'll just put the breast drape over it. But that's what I do for a female client, but since this is a male client, I don't need to do it. So we talked about earlier in the class the case studies, revision liposuction. I had a case where a gentleman had a liposuction for the second time, just to target some additional areas he wanted targeted, but the surgeon said since there was not a lot of liposuction done, that he didn't need to have any foam or any garment. So he came to me 2 weeks later and said, you know what, this is really frustrating for me. I feel like the swelling's not going down. What can I do? So what I did for him is I said, ask your surgeon, go ahead and just send an email, can I use the same garment as I used the first time I had liposuction? So the surgeon said, yes, you know, if you want to use that garment, you can. I always have them ask their surgeon if they could use the garment. So the surgeon may say you don't need the garment, but that's not the same as you cannot wear the garment because I've done some kind of surgery that I don't want to use compression after it. So as long as the surgeon is okay for the client to wear the garment, I had them put the garment back on, and then I gave him extra foam in the area right where he had the liposuction. So the foam plus the compression garment really helped, plus the types of massage I'm going to do today. There's a separate class that deals just with compression for swelling and fibrosis, so I'll talk more about compression and foam options in that class, and in this class I really want to focus on the hands-on massage work. So I'll show what to do for a client that has liposuction in, if it's a man, it's the upper chest area. For men and women, it's the abdominal area, the flanks area, and then we'll also do if they had liposuction in the upper arm area. So the second other things I've heard of in our case studies on the lumps and unevenness after they harvest the fat for the breast reconstruction surgery. Usually they'll have lumps and unevenness in this area. Again, the plastic surgery recovery massage and the compression can really, really help clients who are in that situation. And then this great thing, I'm really excited to show this to you, and this is something that you'll be able to grab directly from your massage education. If they have limited range of motion after abdominoplasty, tummy tuck, or arm liposuction, 360 liposuction, often the clients will come in and they'll say something to the tune of, you know, like I feel like pulling taffy, I feel really tight, I can't really move, and oftentimes the clients won't say anything, but I would just always do this, throw in, 5-10 minutes of this type of massage that I'll show you for the increasing range of motion, and then maybe they'll be like the client that I had last year, that she came in after the second massage and said, oh my God, I can finally turn around to toilet. And that was something we hadn't talked about, she hadn't mentioned at all, but we're able to really let them get more range of motion after the surgery, and that's just going to increase their recovery. So the one time that I wouldn't encourage them to have a lot of range of motion is if they had a breast augmentation or the recent mastectomy, and their surgeon does not want them to lift their arms up above. So I would always ask them if they had anything kind of surgery in the upper chest area. What did your surgeon tell you that you couldn't do? And so obviously you're not going to do that on my table either. So if they have any kind of breast augmentation, I say, are you sleeping on your tummy yet? and if they're not sleeping on their tummy, if they're not even trying to get to that point after surgery where the surgeon will tell them, try 5-10 minutes on your stomach. If they're not there yet, then you won't turn them over and they won't be prone with their face in the face cradle. They'll be side lying. So you can still do everything while they're supine, and then just have them side lying to address the swelling and any fibrosis on the back. If they have a Brazilian butt lift, I do a separate way of bolstering them. Right now I have his legs up on a lounge doctor. This is a specific type of ergonomically designed bolster that raises the legs up, and it's specifically designed by a vein doctor for use on his clients after surgery. So I really love this, and it's gotten me really good results. It's very, very very comfortable for clients, especially if someone has had the tummy tuck abdominoplasty. They can't be straight on the table. They have to be at an angle to protect that incision. So let's see. My computer went off before I have this. And then, and then the fourth case study, just lumps and bumps after liposuction. So we get into more of the fibrotic treatments that I do with the different tools. You'll see how those can really help. And again, it goes hand in hand with compression. I only have 1 or 2 hours with them in the office here a week. And the rest of those hours, the compression is going to do the job to reduce the fibrosis. And this is what we know directly from our training as lymphedema therapists. We can only get them in to do MLD after decongestive therapy very, very rarely, but what's going to do the job most of the time is going to be the fibrosis, is going to be the different levels of compression and the compression tools. So what do I do? When I get a client on the table, the first thing I'll try to see, I don't just focus right where they have the liposuction. I want to look at their face. I want to look at the upper eyelid. I want to see if there's any right around here, is there any swelling? And this is like what we see after you do like sushi, anything with a lot of salt. You had a bunch of drinks last night and you wake up and your eyes are puffy. So that's how you do swelling in the face. In the arms, I'll look at the hand, on the back of the hand. Can we see the veins? Can we see the bones? And then ask them if they think their hands are more swollen. And then on the feet, as you're lifting the drape to put the bolster in, take a look at the top of their feet. Are their feet swollen? Is this more swollen than they usually are? So that is a great tool that we learned from lymphedema therapy world that I want to bring and show the massage therapists, that we should kind of get an idea of what the level of swelling is in the entire body. And that can be something that will open our eyes to, are we going to address swelling right here, or are we going to give them different ideas, different exercises, and really tell them to go strong on the tips that we would give them on how to reduce swelling throughout the entire body. So we did that, and then some of the tests that we can do as we're just doing the initial massage, and I hope that you've had manual lymphatic drainage training, and as we're doing the initial types of MLD massage, which I won't show because that's a separate 45-hour class. I would encourage you to take. I got my training from one of the big 4 schools, but there's many schools out there that will put you through either a 45-hour or a 135-hour program. So as we're looking and as we're doing the MLD massage, we can also see, is there pitting? And that would be pressing in on the area where we think there might be massage, and then pressing in for that area for about 30 seconds and rising up. Is there any divot? How soon does the divot fill back in? How long does it take it to fill back in? How deep is the divot? Like was it just a few seconds before you felt yourself sinking in to this divot? So that's one of the tests we can do to kind of put in our soap notes what we see for the swelling and how it is presenting this week. We can also do a Bjork bow tie test. Elsewhere in the class, I've shown the link to the video where you can see that, but you can definitely do a bow tie test and see if there's any like fibrotic tissue in the area. And then just note that in your soap notes, and then you can see from week to week, when you look at your soap notes like 3 weeks ago and now you're looking at the client today, you can say, hey, like, look, this fibrosis is really getting more mobile, and how are you feeling about that, and do you notice that too? And that can be very encouraging for the client. Then what do I do? So I'll do the initial MLD massage, and then I'll move on to warmth and vibration. So I'll do just a regular massage with lotion, and then I'll add hot stones to it, and then I'll do a little bit of cupping, and then I'll do some lengthening strokes, and then finish it off with a final pass on the MLD, and then just check the tissues again after that. So let's look at the cups, and then I'll actually get into the massage and you can see a little bit. So I use a cupping machine. So these cups go from the machine, and the machine does the pumping, and then I also use the Russian silicone cups. So I'll use these together on the skin where, say, the pumping is here, and then as the pumping goes in, this cup will pull out in different directions. They can both pull out in different directions based on where I see the fibrosis and how I want to move it. And then you can also use 2 of the Russian cups if you don't have the pumping, and you can use 2 of the cups and then pull them apart. You can have 1 and then do like a sun and moon kind of idea, and just play with this. This is something that I've just played with, and I've kind of invented and seen, and been very experimental with clients and seen what works on one client, tried it on another client, and then that will be what I do. So for the cupping, you can do a pumping, so that's just laying it on the skin and it will pump by itself if you have the machine. You can also do gliding, where it's either a pumping pressure or a static pressure, and then you're gliding it across the skin. You can do rotating cups, whereas the suction is there, you're actually moving the cup around. That can be really good to kind of break up that fibrosis. You can do a scoop, which is kind of pulling up on one side of the cup as the suction is there. I showed you the sun and moon, and then the pull apart like this, and then like a sunburst, like where you're just pulling apart from the area as the central cup is pumping. So that's kind of, I'll show it to you a little bit organically during the massage, but it's something you just have to get your hands on a client and try to get your hands on a regular client without liposuction, and then some after liposuction, and see how the skin changes and how it becomes under the cup. So that's the other thing that I really like, is when you use the cups, use them, and this is my teacher Keone Salgado taught me this in our lymphatic massage cupping class. Use the clear cups when you're in the office whenever you can, because then you can see inside the cup, you can see what's happening. So if you have skin, you'll be pumping on normal skin that's unaffected, and then the pumping will just pull the skin up, pull it back down, but you won't have any redness. But if you get this cup on places that is fibrotic, tissue is not moving so well, you can see either there'll be an indent in the middle of the skin where that scar is there and it's holding it down, or the entire skin underneath will just get temporarily redder, and then you can see so the cup is really doing its job if the skin is temporarily red. I don't leave these cups on long enough for any Shaw to come up, so there's no bruising, there's no red marks on the client at the end of the session. But knowing what is happening in the beginning of the session, in the middle of the session, is very valuable for seeing how easy it is to move the cups. And then the other thing I've seen is if there's some swelling, like a pitting edema, like we would do this, and then you would find a pit. Oftentimes the cups will tell me that before I have to take the edema test myself. Is if I'm cupping for somewhere for a minute or two and it's sucking, releasing, you can pretty much leave the cup on someone as long as you want, because it's not sucking and bringing up Shaw, it's always releasing. So if you set it to pump and then you take it off or you move it, you'll see an indent in the skin from the edge of this cup. And that to me shows the same thing as if I did a pitting edema. You can definitely tell if there's a bunch of circle indents in the skin at the end that this client does have pitting edema. So that is the overview of the tools that I use. So the next video will be me actually doing the massage. All right.